there, and welcome back to the Beyond Clean Expert Series. You're watching the Borescope Expert Series, where we bring to you some sterile processing subject matter experts around borescope usage to answer your questions about how to implement a borescope well in your department. I'm Bobby Parker with Beyond Clean, and I've got Jenni and Andy here with me to answer some borescope questions. Today, we are talking about what to do whenever you find issues in your borescopes, be it debris or damage or droplets, or is the other D discoloration, Andy? Is that the one from a previous episode? I did it.
You got it.
How do you respond to those significant, severe findings inside of a borescope? It's not just enough to discover that it's there, I guess is the point. So, Andy, what are some suggested tools or protocols that you think have been helpful in facilities when it comes to handling these kinds of findings inside of a scope?
Yeah, well, I mean, newsflash, it's not a matter of if, but kind of when we're going to find something with the borescope. So, the protocols, you're right in saying that the protocols or the process around handling, these findings is pivotal. Actually, I'd like to put it back to Jenni. Jenni, you have some great processes and procedures. You've looped in the team. They're all engaged. What does this look like for you, and what steps do you watch?
First is empowering the technicians. They know that it is their responsibility to stop the line, so to say. If they find something, they need to say something. It's just an expectation. Like, they're doing that inspection for a reason, and they have that power to say, this is not right. There's something going on in this scope. So that's the first thing. And then what's your process when they find something? Ours is pretty, we try to make it pretty easy for them. So we have a standard process is, you do your manual clean, you do your verification of the manual clean. One of those tactics we use is internal channel inspection. It would be no different if it was the external inspection, our ATP testing result, whatever that is. So you're verifying that manual clean. If it is debris and discoloration of those two Ds that they find, and maybe some droplets, depending on what it is, their standard work is they find something, it fails their cleaning verification, and they have to re-clean it. Easy, So again, you go through the process, you verify it's clean, it's not clean, you re-clean it. At that point, hopefully it's passed, and then it goes on through the process. If it still fails at that point, then we have, they need to document it, they need to mark that it's failed, especially in our scopes, we track all of that specifically. And then they need to pull it out of service, and that's okay, that's the expectation. And then the next person in the process is that person who sends it to repair, maybe double checks the decision. Is it good? We're just going to watch it. We're going to pull it, whatever that process is. So who's that next decision making person? And that's different in every organization. For me, it's my instrument specialist. Some areas that might be leadership. It might be an educator. It doesn't matter. It's just who's that next step to make that final call. So no technician is alone in that, but every technician has the power to stop the line and make sure that, say, this device is not right. And then always do that documentation. We take it a step further then and use some of that, again, what is that picture? We send a picture with when we send it out for repair to an OEM or a third party or whoever we're sending that to, so they can say, like, this is what we want repaired. We saw this in the channel. Again, so using that data that comes from that inspection point is, again, part of that standard process.
I imagine you get some mixed reviews from your manufacturers on seeing those pictures, right? Because in one sense, that's really helpful. In another sense, it's like the number of times you've probably been told, we've never been asked that by a customer before. So,
yes, yeah. But honestly, it's made the process, and this is part of partnering with your vendor. Like, this is exactly what I need repaired. I need an answer to this, versus them doing their whole process, which they're still going to do, but it makes it more concise, and then we're easily more aligned. So it's actually always been pretty much a positive. So
yeah. Andy, from a borescope manufacturer's perspective, who's had to work pretty closely with some scope manufacturers, anything that you would add to what the review process is? I mean, Jenni, that process sounds great, but anything on the back end that you want to recommend as well, Andy?
Yeah, I mean, I think Jenni's process is dialed. There are some great nuggets in there, so I do hope people will go back to listen to those, specifically on how she handles the 4Ds. But a couple things do stick out. There is software out there. There's tracking software that a lot of hospitals that we bump into are using. Lean on those processes as well. the borescope can seamlessly fit into that process. I think the main thing that sticks out on that is, if you find something that needs to fail the device, let's make sure that endoscope or that device does not, advance in the system and get used on a patient. So and if the borescope's one of those cues that triggers a flag for that, that's probably the biggest thing that needs to stick out in that process. I've said this on earlier, but also, the Borescope software, there are more advancements coming down the pipe as well, and that are available actually at this point too. So, if you're feeling overwhelmed with developing a process like Jenni outlined, there's some stuff that's right out of the box that can get you to that point to make an effective Borescope process, one that everyone can jump on board with. It's monitoring, it's tracking, it does all the things that need to do with the visuals backing it up.
But I want to jump in and say too, again, if you're just starting somewhere, you don't have to have all that traceability and tied back. Some of you might not have an instrument tracking software, or things for that to tie into. That's okay. Then it can be a manual thing. It can be a log sheet. It can be something that the person you elevate it to gets to. It can look very different. It's just about having that piece of documentation somewhere. And the big thing is giving the techs the permission and that authority to stop that line and pull that device out when they see that something's not right.
Yeah, that's a really helpful thought to add. We just want you to have a borescope and start using it, right?
Yeah.
You don't have to be all the way from day one. It can be kind of a scary thing whenever you find something significantly wrong with the borescope. It's also a sense of relief, thank goodness we didn't send this up to the patient in this condition, but can also help drive some positive changes. Andy, have you seen borescope findings be the catalyst that has helped a facility maybe turn the corner on fixing some procedural problems, either in the reprocessing department or maybe in their OR or something else?
Yeah. Well, absolutely. I mean, and what a better way to get those stakeholders all on the same page and start agreeing, okay, here's what we're seeing. It's tough to disagree or argue about what we're seeing here, whether that picture or video with the borescope was done, right after the procedure and right after manual clean, or, it's a patient-ready device. And so we're comparing before after type of visuals with the borescope. All those are very powerful, getting everyone together to basically develop, what's root cause of this situation. And I got to believe everyone's going to say, well, let's figure out how to fix that. So Jenni, I know you got a lot of thoughts on this one too. Yeah, I'd love to hear it. Let's go.
One, it's how you use it and then what you do with that data. So, one, you can use it as an audit tool to internally in your sterile processing department. You can audit, again, the verification of the manual clean. You can audit, again, a new technician training, a new instrument that you're using. Are they really getting it clean? The new ERCPs with the detachable tip, are we able to get some of that stuff done a little bit different? So it can really drive change with maybe how you train, the length of your training, education you're bringing in. It can impact a lot of those different things, but overall, that it leads to improving the quality of the reprocessing. Trends, if you see trends in where things are failing, then again, you can impact technician or education, what needs to happen. But maybe you need to then review the IFU. Maybe it's an outdated piece of equipment you have, and when you look at that IFU, and then it can lead to updated technology too if it's that difficult to clean, and an updated device is that much easier. So again, it can lead to some partnerships with vendors, with the OR team on, we don't like this trend that we're seeing, going back to that root cause when you have a compromised sterility event or a positive scope culture, and you're digging into that and asking those 5 whys and getting down to it. Is it something new that you're bringing in that has a cannula and you need to add it to your list of things? You can address gaps and defects in the reprocessing process, we didn't have this one on our radar but now that we've seen a compromised sterility event to it, that's something we need to add into this. The goal is always to get to 0 defects. So how close or how far away from you are that? What's your compromised sterility rate to the OR? I know mine. And, it can also help with instrumentation levels. If it's a complex device and it fails often, maybe you need another device. Maybe you need another gastroscope to your line because of, again, how often they're going out to repair. Maybe you need a second set of an instrument set because, again, it's prone to pitting or scratching inside that instrument, and you're pulling it out or sending it out. So it can really impact a lot, which again impacts your team down the line.
I imagine, particularly in that conversation that seems to always happen between the reprocessing departments, whether it's instruments or scopes, and the procedural area around that point of use cleaning, sometimes having a good image of what the impact is to those devices, both externally and particularly internally, can go a long way to try to win over some safety champions at the point of use as well. I've seen that personally in a department that I've led. And that can be really powerful.
It can be very powerful in that partnership. And, if it's dried or this, or, are they soaking appropriately, and what's just reviewing some of that, but that tie to that whole process. Absolutely. Are they flushing the lumens in certain procedures or not, in the OR with that point of use? That's a big deal too.
For sure. Guys, thanks for this really, I just looked and 10 minutes have gone by again already. I can't believe it. Thank you for this really rapid conversation around just the effective use of borescopes, particularly related to performance and findings, and what do we do after a finding, and how it can help not only rescue a patient in the moment with this one device, but it can also spark some procedural change, both in how we reprocess the instruments, but also how the instruments are being cared for its whole use. The next time we get together, I want to talk specifically around how to give permission, if you will, to technicians to spend a bit of time with their instruments, and maybe how to reel back in some of those eager beavers, or maybe spending a little bit too much time with their borescopes, because I know that's something that departments that are looking at implementing borescopes are fearful about. So I want to make sure that we talk about that in this series. If you've been watching this Borescope Expert series and you've caught a couple of the episodes, I would encourage you to go back to the source, look at the whole playlist, and watch through all of these topics. If there's one we haven't covered yet that you really want to hear about, or if you have a specific question that you're not sure that we're going to get to, I would encourage you to reach directly out to Jenni and Andy, and they would love to talk with you about Borescope usage. You can find their contact information in the video description. And until next time, I would encourage you, as we always tell you here at Beyond Clean, keep fighting dirty.